When should your baby start babbling? I'm Dr. Mona Amin, a board-certified pediatrician and mom. Today we're talking about speech milestones in your baby's first year, how to set the foundation for communication and language, and red flags to look for. If you're new here, be sure to hit that subscribe button so you don't miss out on more videos that help you navigate your child's health, development, and behavior with confidence. Let's get to it. Language and communication are essential parts of your baby's growth and development. Even before they say their first word, mama, dada, they are building the foundation for communication in incredible ways. Communication is the exchange of information. So for example, a baby crying to signal hunger or discomfort, cooing sounds or smiling when they're happy, eye contact or pointing to grab your attention. Now, language involves using words or sentences to express thoughts. For instance, a baby babbles baba at first, but eventually says their first clear word like mama or dada. Think of communication as the whole pizza. It's the big picture of how we share and understand ideas, feelings, and needs. It's how we connect with one another, using everything from words and gestures to facial expressions, or even the infamous mom look that says, "Don't even think about it." Now, language, that's just one slice of the pizza, the specific system we use to turn our thoughts into words. It's like the toppings on that slice, the vocabulary, grammar, and rules that make words and sentences meaningful. Communication is the ultimate goal, and language is just one of the tools we use to get there. Even before kids can talk, they're already communicating all day long, sometimes louder than we'd like. Cue the baby shrieks. Even before babies say their first word, they're hard at work developing skills that lay the groundwork for language. From the newborn period, babies are building connections through eye contact, turn-taking during coos, smiling, and responding to voices. Babies recognize familiar sounds and voices even in the womb. This helps them tune into language and its patterns. Long before they understand words, babies are picking up on facial expressions and body language to make sense of the world. These foundational skills are like the crust of the pizza. They support everything else and are essential for your baby's communication and language development. Okay, anybody else a little bit hungry with all that pizza talk? Back to development. By recognizing that communication starts long before spoken language, you can focus on fostering these skills early on. And don't worry, it's all about small, everyday moments that make a big difference. Now let's look at the key milestones for communication and language in the first year of life shown here. Every baby develops at their own pace, so don't worry if your little one reaches these milestones slightly earlier or later. What matters is the progression over time, and I'll go over some milestones to monitor at the end of this video. If this video is helpful so far, don't forget to like it and subscribe. I'm here to support you through every stage of your parenting journey, but I need your help by subscribing to keep this channel going. Let's talk about how to help your little one learn language. And spoiler alert, it's all about keeping it simple, fun, and part of your daily routine and setting a healthy foundation for communication. This should not be difficult because you make it part of your life. Let's talk about Speak, a simple way to build your baby's language and communication skills. Sing, play, expose, act, and keep it reciprocal. The best part, it's not extra work. It's about making the most of the everyday moments you already share with your adorable baby. Life is busy, but connecting with your child can and should feel natural and fun. Before we dive in, here's something to keep in mind. Your baby's development works like a team effort. Social, emotional, and cognitive skills all play a part in helping them learn language. When you chat, sing, or play with your baby, you're nurturing all of these areas at once. Let's talk about the S, sing. Use songs and rhymes to build rhythm and sound recognition. Songs are a goldmine for language learning, and I know it can feel a little bit annoying, but there's a reason. Think Old MacDonald, The Wheels on the Bus, or even your own silly tunes. Moo moo here, moo moo there, here a moo, there a moo, everywhere a moo moo. Yes, it's going to get stuck in your head, but it's worth it. Singing combines repetition, rhythm, and melody to make words stick. It also grabs your baby's attention and teaches them how to move their mouth for sounds. Add some motions like the wheels on the bus go round and round, round and round, round and round with hand movements. Combining actions with songs makes it even more effective and so much fun, and also can help them build that foundation for language. And when you have a nice positive facial expression, it can help too. P is play and pause. Play is the ultimate way to connect with your baby and teach communication, which is really important after 4 months. Games like peekaboo after 8 or 9 months, or imitating their sounds in general, build trust, joy, and language skills. Here's a fun trick around that 8 or 9 month age and beyond. Ask a simple question like, cow goes, then pause. Give your baby time to answer. Maybe they answer with a sound, a giggle, or smile. That's communication. If they say silent, you can answer for them. Moo! This teaches them that conversations go both ways, but patience pays off here. If you answer right away, you're not giving them time to register what you're trying to say and help them understand that with communication, there's speaking, pausing, and then speaking again. E is expose. Babies are like tiny sponges, soaking up language from birth. Narrate your day in parentese, that sing-songy way of speaking where you stretch out words and use a higher pitch. It grabs their attention and makes language learning fun. And this is not baby talk like Gucci Gucci goo. No, you can do that, but this is saying the words and phrases you would normally say, but just adding it in a sing-songy musical way. Example: 1 sock, 2 sock, look at you, ready to rock those socks. You see how it's different than 1 sock, 2 sock, let's put on your socks. You are adding musicality and excitement in your face. This helps them feel more connected and also helps them learn language. This has been proven time and time again that this parentese way of speaking is really helpful. Now, this may not come naturally, so you can practice it and do it to the best of your ability. My husband is really not that great at parentese, but I am. I think about it like a Disney character and I'm just singing my way through life. Let's pour some water, 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 versus being quiet. So add that sing-songy language to your life. For extra engagement, add some motion. Let's put on socks, socks, socks as you tap their feet. Even if you're getting a bottle ready, mommy getting bottle, bottle, bottle. Pretend you're in a one-woman or man theater and watch your child enjoy the production. Even if they're not speaking right away, which is not the goal, they are going to smile, they're going to engage and set that foundation for communication and language to come. Part of playing and doing all this is don't forget to read. Start with board books and point to pictures. Look, a dog. The dog says woof woof. It's less about them understanding every word on the page and more about building a love for books and your voice. The next is A, act. Pair words with gestures. When you wave and say bye-bye or point to a toy and say, look, a ball is rolling, you're showing your baby how language works in the real world. It's like playing charades with words. So you're basically acting. Babies naturally start mimicking gestures after 6 months, so pairing actions with language helps words stick even more. K, keep it reciprocal. Treat your baby's sounds like real conversation starters. If they say baba, respond with excitement. Oh, you are telling me about the ball. Let's play with it. Mimic their sounds. If they say baba, you can go baba back. Sing with them. So ba ba ba, ba ba ba, ba ba ba, ba ba ba. And even if they make sounds like raspberries, do a raspberry back. Teach them that communication is reciprocal, that they're going to make a sound and you can make a sound back. When they reach that screeching age, around 9 to 10 months, and they're not really saying words, but they're going ee or ooh, you can respond back. You can say the same thing that they're saying, or you can say, oh, what are you trying to tell me? This gets their attention and sets that foundation again for communication, and that is what's going to help them form actual spoken language. This back and forth interaction, the mimicking their sounds, the facial expression mimicry, or even the raspberry mimicry, this interaction builds their confidence and shows them that their voice matters. And remember, overall, keep it real, not digital. Face-to-face time beats screen time any day, especially under 1. Babies learn best by watching your expressions and hearing your voice. Under 1, keep those devices away, except if you're video chatting with a family member. This is because we really want the mimicry, the reciprocity, or that back and forth conversation, and the social and emotional bond as a foundation that only interaction with another human real time can give. While every child develops at their own pace, there are certain signs that could indicate a delay in language or communication. If your baby hasn't hit every single milestone exactly on time, don't panic. Development is a spectrum. But if you notice any of the following, make sure to speak to a clinician. By 3 months, your baby isn't making eye contact with you, or your baby is not smiling when you smile, or your baby isn't responding to sounds like turning their head towards a noise or your voice. By 4 months is not cooing. Cooing sounds like By 6 months, they don't make any squealing or laughing sounds. Laughing is pretty self-explanatory. Squealing, ah, ah. By 9 months, they aren't babbling repetitive sounds like ba 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 da 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 la la la. By 12 months, your baby isn't saying any simple word like mama or dada or maybe another word. The baby's not looking where you point. They don't use gestures, and gestures can look different child to child, but you should know what they're doing. So for example, waving, pointing, or maybe their whole hand is pointing or shaking their head. They don't respond to their name or recognize common words like no or bye-bye. If you notice any of these, trust your instincts and don't wait. It's always better to address concerns early. Here's how you can potentially get help. Talk to your child's clinician. Your child's clinician is your first stop. They can assess your child's development and may recommend a hearing test to rule out hearing issues, which can affect speech development and their ability to turn to sounds and communicate. Reach out to early intervention services. Now, if you're in the United States watching this, early intervention programs offer free or low-cost evaluations and services for children under 3. These programs can provide support like speech therapy if needed. Consider a speech-language pathologist. A speech therapist specializes in helping children with communication and language concerns. They can provide targeted strategies to support your child's progress. So if you have this in another country because you don't have a program like Early Steps, or if you're concerned that your child doesn't qualify for Early Steps, self-referring or getting a referral to a speech therapist can really help. And also, trust your gut. If something feels off, don't let anyone dismiss your concerns. You know your child best, and seeking support early can make a big difference. Remember, every child is unique, and a delay doesn't always mean a long-term concern. Early support can help many kids catch up to typical development, but more importantly, give them the chance to thrive on their own developmental curve. Most importantly, be patient and keep engaging with your little one. They're learning from you every single day. For more on milestones in the first year, make sure to grab my free Milestones to Monitor PDF available in the caption. If you have concerns, early support is key, so don't hesitate to reach out to your pediatrician or explore resources like early intervention programs. For more tips and parenting advice like this, make sure to subscribe to my channel and join a community of parents who are committed to raising happy, healthy kids. Bottom line, to foster your baby's communication and language in the first 12 months, make sure to speak. Sing, play, expose, act, and keep it reciprocal. What communication and language milestones has your baby hit in that first year? And are you concerned about anything? Comment below and also tell me your favorite ways to encourage them to communicate and promote language. If you found this video helpful, please give it a thumbs up sign, share, and subscribe for more content tailored to help you understand your child's health, development, and behavior with confidence. Comment below with any questions, comments, or personal experiences with your child's speech in the first 12 months. The next video on this channel will highlight language development in year 1 to 2, which is very key, so subscribe so you don't miss that. I hope I brought more confidence into your parenting journey. That is what I'm here for. So stay informed, stay empowered, and I'll see you all next time. Stay well.